This is the Neoliberal Around podcast.
People are not aware. Okay, over the last couple of weeks or days, Penny announced that 85,000, about 100,000 people were insured. Had to the Pennsylvania alone, which is the Obamacare. In each state have their own Obamacare. The Pennsylvania version of the Obamacare or the Affordable Care Act is Penny, okay, and Penny, they are responsible for signing up people. Now, they announced that 85,000 people dropped their insurance, dropped the Penny insurance. 85,000. So now only 15,000 have it, and that's a problem. The reason why 85,000 people drop it is because to renew your health insurance plan this year, it's through Penny or through the Affordable Care Obamacare, it increased by 102%. People can't afford that. Okay, so now people are going to be
Renaldo, can't people just get jobs now? Can they just get a job?
But some of these people are independent contractors or small businesses, okay, who can't.
So people who are independent contractors and small businesses, what are they supposed to do?
I mean, they're just gonna go to the hospital without going through an insurance regularly, because if you don't apply through the Obamacare, then maybe you can buy health insurance another way. But as I tell you, it's too expensive to buy health insurance. That's why they have dropped it. They dropped their health insurance because it's 102%. Now, you can't go and get your health insurance to an employee, to an employer, or employed insurance. You either get an employed insurance, okay, or maybe apply for Medicaid, Medicare, but you can only apply for Medicaid and Medicare if you have a medical issue, or if you have a medical issue, that's when you get the medical care, Medicaid and so on, for seniors or people with a medical disability or whatever. They will qualify for Medicaid or Medicare. All right, but so independent contractors, independent workers like Uber drivers and Lyft drivers, or people who work in logistics, who are commissioned workers or insurance sales agents or whatever the case is, or small mama and papa shops or small businesses that have 10 people, 15 people that cannot afford to have a kind of health insurance like Wells Fargo and so on, that big businesses that can afford to have a health insurance plan for their workers. These small companies that only have 10 and 15 workers, they can't afford to buy an employment insurance for their workers because it's small and they can't afford it. Okay, that's a big hit for them. So now they are dropping these people are dropping their insurance. What's gonna happen is, and you said earlier, why they can't go to the clinics and why they can't go to these places. And I'm saying to you, if they go to the emergency room or go to these places without having insurance, okay, it's gonna drive up the cost for insurance for regular people who are double or two employees. Sorry, people like you and me who have regular jobs are going to now have to foot the bill, but okay, because to cover these costs of the people now who drop their insurance, who now show up at these places to get health coverage or go to the emergency room or whatever the case is. So that is going to be part of the problem. It's going to drive up the cost of health insurance for regular people who have regular jobs. That is a problem, and that is why the Affordable Care Act or the Obamacare was very meaningful and helpful, because it helped to keep a balance. It helped to keep insurance rates low for regular Americans, for middle class Americans. Yes, it did that, and not only that, it provided some kind of surplus, because before Obamacare and Affordable Care Act, Medicaid and Medicare was losing money. Okay, and people who never had it, and of course, people are now paying for insurance who never used to have health insurance. So it really helped to create a balance in the insurance industry in some ways. But now Donald Trump wanted to get rid of Obamacare. He wanted to get rid of the Affordable Care Act. They were largely unsuccessful 4 or 5 years ago in getting rid of Obamacare. It was very difficult because there was no support for it in the House. Okay, and although and I don't think they'll be able to get rid of it now. Okay, so instead of getting rid of Obamacare, he said, okay, let's get rid of Obamacare by driving up the cost of health insurance by not providing the government premiums that we normally pay. Okay, so now they're ultimately trying to kill Obamacare or the Affordable Care Act because people are dropping their insurance. However, the requirement is still there because people are required to have health insurance. However, people can't afford it. How can you require people to get insurance who can't afford it? So therefore, people now there is a way, now there is a plausible discussion to say that, okay, let's get rid of Obamacare because we can't require people to get health insurance if they can't afford it. And they can't afford it because they have withdrawn the government subsidies. And that was the idea. Get rid of the subsidies so that people can drop their insurance, health, Obamacare, so that we can now get rid of the mandate and the Affordable Care Act altogether. That's the idea. That's the idea. That is the strategy. This time around, they have been very strategic in terms of getting rid of and upending Obamacare. And then again, of course, they don't want anything to be, there's a problem with a black man in office. A black man that has done great thing because black people, nothing good enough black. This black man, this African American man should not have done this. And they are mad about that. And so what they did was, in fact, Donald Trump just dressed up Obama and the First Lady to make them look like Africans. Disrespectful. Distasteful. He has no respect. And that's the idea, to get rid of black success, to get rid of black achievement. Donald Trump, by dressing up the Obamas as apes, okay, his idea was to put a dent into black achievement, to say black people will never arise and amount to anything. Get rid of their signature achievement, okay? And I can do anything that I want to do, but they can't do nothing or anything. That's the idea here, ladies and gentlemen. Ridiculous. And and I'm saying to people, how can people have respect for the presidency if they are going around strategically like this? How is this possible? But that's what's going on in terms of healthcare, ladies and gentlemen. I'm Renaldo, McKenzie of the Neoliberal podcast.